Welcome to China in Focus. I'm Tiffany Meyer. Our top story: President Trump unveiling a roadmap for charging reciprocal tariffs on all nations that charge duties on American imports. Details on this move primed to shake up global trade. A microbiologist is calling on the U.S. and other Western countries to stay vigilant against a surge of viruses inside China, plus human infection caused by the avian flu virus. To investigate the situation in China, NTD spoke to residents across the country for first-hand reports. And the U.S. is asking Europe to step up its own defense. This as Washington shifting its focus to deterring war with China in the Pacific and securing its own borders.
I think it's part of this rebalancing, and that's why Europe needs to step up and do more.
Welcome to China in Focus. I'm Tiffany Meyer. Before we dive into today's news, make sure to use the link down below to subscribe to our newsletter. Each week we round up the highlights and controversies happening around China and the world and share an exclusive behind-the-scenes snapshot with our readers. Keep an eye out. The newsletter will land in your inbox Friday morning. And just in, President Trump has signed a major trade memo directing staffers to determine reciprocal tariffs rates for trading partners. He said that he decided to charge a reciprocal tariff on countries that charge the U.S. for what he called purposes of fairness. He added that, quote, in almost all cases, they are charging us vastly more than we charge them, but those days are over. Howard Lutnick, Trump's pick for Commerce Secretary, said the administration would address each affected country one by one. He noted the administration's calculations on the issue would be completed by April 1st. Turning to today's headline, viruses are surging inside China. Over the past few months, footage circulating online has shown Chinese hospitals filled with patients. And social media posts across the country are reporting growing numbers of deaths in their communities. Meanwhile, bird flu viruses are killing huge amounts of poultry in China daily. Doctors and nurses in some provinces have even held emergency medical drills recently. What's going on with public health inside China? And are the U.S. and the rest of the world doing enough to protect their citizens from a potential outbreak? An expert who closely monitors situations in both China and the U.S. says no. Before we dive into the experts' analysis, let's hear what some residents living in different parts of China have to say. To protect their safety, we distorted their voices.
Are there a lot of people with fever and cold symptoms?
Yes, a lot. It's mostly elderly people and children. You can hear my child in the background. I have a child. And my mother is also sick. There are also young adults in their 20s, teenagers, and elderly people in their 70s and 80s. Many of them are catching colds. It seems like a new virus.
Oh, what does the hospital say the illness is?
They just say it's a type of flu.
I just had a fever. There are so many sick people, both adults and children. It's severe. Runny noses, sore throats. But no one is saying what virus it is, and no one is admitting anything. The hospitals are very crowded.
How long do people have to wait in line?
A very long time. Everyone has to wait for hours. 5 or 6 hours, sometimes 6 or 7 hours.
When did this situation start?
It's been going on for over a month now, a major outbreak.
There are so many cases of fever and cold. I just got it myself. I'm still not fully recovered. Some have vomiting and diarrhea, some have fever, cough, body aches, and fatigue.
How many people have gotten sick in your area?
A lot. The symptoms seem similar to the common cold in the past. It's probably still COVID. Medications don't seem to work.
There's an outbreak in the north. My uncle passed away from white lung, fluid in the lungs, and was buried today, but I didn't go back. He was in great health.
Are there others?
Quite a lot. That's what I've heard. There are many cases. Right now, crematoriums are overwhelmed with people lining up for cremation services. A lot of people have died. The hospitals were already overcrowded before, and now it's even worse.
Just look at the crematoriums. They're overwhelmed. They can't do same-day cremations anymore. Families have to bribe the crematorium staff or pay extra just to get service. Can you imagine how many people have died?
Are there a lot of people in the crematorium?
Of course, sometimes people have to wait 5 or 6 hours in line.
The eyewitness reports are causing concern. Several interviewees told us that they believe the Chinese regime is covering up the severity of the situation. Several people echoed that hospitals and even funeral houses are aiding that censorship. Others said staff members at crematoriums are urging people to not film the crowds gathered there. Some also raised doubts over the flu test results from Chinese hospitals, noting the medication they're being given, which targets the flu, doesn't appear to ease their symptoms. They say doctors have also refused to address doubts over the test results. Sean Lin served as a microbiologist for the U.S. Army for 7 years. He's also an assistant professor in the biomedical science department at New York-based Feitian College.
I think from the netizens report, the videos and the many posts, it's very alarming. And these waves, many people suggesting is even bigger than during the COVID period. And so I think it's very, very concerning. The Chinese government only emphasizing this is a regular winter season. Chinese government recognize there are spikes of these different pathogens. But however, it cannot explain why so many people have severe symptoms, why so many hospitalizations as well, why so many deaths.
The Chinese CDC published its latest report on the epidemic of respiratory diseases nationwide on Thursday. It claims the trend of infections is declining, with no new or unknown pathogens identified. It also says the influenza virus is the primary cause of the respiratory infections. In its most recent report focused on the influenza virus, the Chinese state-controlled agency claimed that both northern and southern China saw fewer positive cases, with only one regional outbreak reported. These reports mark a stark contrast with what residents say. Now, people are raising questions over why hospitals are holding emergency drills if official notices say infections are on the downswing.
I think the Chinese government is actually hiding something very serious. And so from different information we collected, we can see many provinces in China actually have drills for avian flu human infections. Like in Shanxi province, Shanxi Taiyuan cities, in Fujian province, in Fuzhou cities, in Guangdong province, there are many provinces they actually have drills and to prepare for avian flu human infection. So there's a huge alarm signal.
Another concern is that despite those drills, the Chinese regime is still moving full steam ahead with efforts to boost tourism to the country. That's in hopes of boosting its sluggish economy. Last December, Beijing announced a 10-day visa-free policy for citizens of over 50 countries, including the U.S., Canada, and the U.K., making travel to China far easier.
I would not recommend people going to China for tourism when Chinese government not transparent regarding about the big wave of hospitalization as well as death tolls in China.
Separate from the eyewitness reports coming from China, let's zoom in on what's happening with poultry, the source of the bird flu viruses. Poultry farm owners in China are reporting major losses caused by bird flu viruses, with social media videos highlighting piles of dead chickens and ducks. Again, such information is missing from Chinese media headlines. Over in the U.S., the CDC reported that the bird flu virus has already affected more than 150 million poultry birds and has already started spreading to other mammals, including wildlife like bobcats and brown bears and livestock like dairy cattle. Last year alone, nearly 1,000 cattle tested positive for H5N1. As of now, the U.S. CDC still labels the risk to humans from bird flu as low. It also had not detected any cases where avian flu has spread from person to person, meaning all human infections have come from contact with infected birds. Despite that, Sean Lin says the health department isn't doing enough to prepare for the potential of a more serious outbreak.
To me, actually, I think the United States or overall Western societies also not pay enough attention to the risk for avian flus. So CDC still evaluate the whole situation as a low risk to the public. But if it can jump from birds to cattle, and it means it the virus adapt to mammalian species much faster. And then it will adapt to human species much faster than from birds to cattle.
An epidemiologist from Florida, Dr. Edwin Michael, raises another potential danger. If a human were to get infected with both a bird flu virus and an influenza A virus around the same time, the two viruses could mutate into a more dangerous strain. And Michael said that new virus could cause an epidemic. The concern comes as the U.S. endures its most severe flu season in 15 years. And for the first time ever last month, the number of deaths from the flu has surpassed the number of deaths caused by the coronavirus.
In New York, like also in Indiana, there are many cases that hospitals are so overcrowded, ICU crowded. And so there are overflows on ICUs for influenza-like illnesses. That means this winter is very unusual, right? So if CDC still treat it like, we just like a regular season collecting data and then do analysis afterwards, it will be late.
The U.S., UK, Australia, and the European Union have recently started preparing vaccines to counter H5N1 human infections. In related news, the U.S. state of Ohio has just announced its first probable human infection of H5N1 bird flu. The patient is reportedly a farm worker who handles commercial poultry. Officials didn't give details on the patient's condition, but most cases of the virus in humans are mild. The Ohio Health Department says the risk of catching bird flu in the state is low, but advises people to avoid exposure with sick or dead birds without protection. The infections adds to a tally of 68 bird flu cases in humans since 2024. One patient in Louisiana died last month as a result. U.S. Defense Secretary Pete Hegseth is sending European countries an important message. He said Wednesday that while the U.S. remains committed to NATO, Europe must take on greater responsibility for its own security. That's because the U.S. will prioritize deterring war with China in the Pacific and securing its own borders.
The PRC's intentions are pernicious, not just in their part of the world, but also in South America and on the African continent. And America's posture there, along with allies and partners, is going to matter about contesting that space.
Hegseth urged Europe to step up to its role in protecting the European continent. He also called for what he called a division of labor, where Europe can focus on its own security and the U.S. can leverage its power to temper China's aggression in the Indo-Pacific. Hegseth said the Trump administration is running on a peace through strength strategy to prevent an all-out war with China. He added, quote, "Deterrence cannot fail for all of our sakes." Stephen Yates gave his take on Hegseth's remark. Yates is the former White House Deputy National Security Advisor.
I think it's part of this rebalancing, and that's why Europe needs to step up and do more, not to stand alone, but the United States has to be a supporting cast in capable areas in order to be able to surge in areas where our neighbors and allies are less capable of reaching as far in inconsequential ways. The broader West or free world has allowed too much transfer of technology opportunity and other efforts to go to China and be concentrated there. And the Chinese government translated that into a massive investment in military modernization and deployment that has destabilized the Indo-Pacific. China's recent aggression on territorial claims and hazing of the Philippines, Japan, and not just Taiwan has changed perceptions and realities across that region. So the United States does have to invest and focus more. But it's not to leave the rest of the world behind. The United States is going to be very invested in a lot of these areas. I mean, just look at what the president has committed to with Israel and the broader Middle East. There's going to be significant investment and involvement in Europe going forward. It's not leaving these areas behind, but it's necessary to rebalance in order for us to surge in areas where Europe and the Middle East can't help America and our allies there as much.
As of now, roughly 375,000 U.S. troops are assigned to the Indo-Pacific Command, while some 100,000 are currently in Europe. President Trump previously urged NATO allies in Europe to up their defense spending to 5% of their GDP. As of now, Hegseth said there's no immediate plans to cut America's military presence in Europe, though he reiterated Trump's 5% spending message. Coming up, the world's largest beauty group is reassessing its global markets. L'Oreal CEO saying the U.S. is the land of opportunity alongside plans to cut reliance on China. And Australia raises concerns with China over a dangerous incident. This after a Chinese jet released flares near the Australian aircraft, almost hitting it in the South China Sea. Details on the incident after the break here on China in Focus. Welcome back to China in Focus. I'm Tiffany Meyer. The world's largest beauty group, L'Oreal, is reassessing its global markets ahead of a potential standoff in global trade. L'Oreal's CEO says the group plans to reduce its reliance on the Chinese market while describing the U.S. as, quote, the land of opportunity.
The CEO added that the company is seeing burgeoning opportunities in the U.S. market. L'Oreal saw a continuous decline in North Asia sales last year. Also last year, the CEO told CNBC that Chinese consumer confidence is a major issue, causing the market's performance to contrast sharply with other regions where the company operates. China's consumer confidence declined to 86.2 last November, approaching the country's all-time low of 2022.
Next, we pivot to the Indo-Pacific. Australia raised concerns with Beijing early Thursday over an air dispute above the South China Sea.
2 days ago, China flew a fighter jet toward Australia's military aircraft while it was conducting a routine patrol over the South China Sea. Australia's defense minister said the patrol was conducted over international waters, adding that the Chinese fighter jet released flares near the Australian aircraft, almost hitting it. Australia's defense minister described China's move as unsafe and unprofessional, adding the department has already raised concerns with Canberra and Beijing. In response, a spokesperson for China's foreign ministry accused Australia of intruding on China's airspace. China claims almost the entire South China Sea as its own, but in 2016, international arbitration ruled that invalid. Countries passing through the waters face frequent harassment from Chinese troops. The State Department views China's claims and what it calls a campaign of bullying as unlawful.
That's all for today's China in Focus. I'm Tiffany Meyer. If you have any feedback on the show or have something you'd like to see us cover, send us an email at chinainfocus@ntd.com. We'd love to hear from you. For on-the-clock original news coverage, visit us at ntd.com or download our NTD app. Thanks for watching. See you tomorrow.